Even as we enter phase one tomorrow, coronavirus cases in North Carolina are still rising. Today, we had 639 new cases, the biggest single-day increase so far. And of course, that is in part because testing has expanded. But one health official in the state is so concerned about a possible resurgence in cases that he's been sounding the alarm about this for weeks. Our Joe Bruno is joining us live tonight. Joe, you obtained an email warning health directors that we're just not ready for this.
Erica, I did a records request and got back all of these documents, and in them I found this email on the top there. It's warning that the state may not learn the lessons from the pandemic of 1917 to 1919, and it's possible we are reopening too quickly. A day before Governor Roy Cooper announced his three-phase plan to reopen the state, Franklin County Health Director Scott Levine sent this email to every single health director in the state sounding the alarm. I feel strongly compelled to urge us to stay the course on our state's social and physical distancing orders. If we remain silent while this relaxation is threatening to unfold before us in the next several days, I am fearful we have not learned anything from the lessons provided in the pandemic of 1917 to 1919. In less than 24 hours, North Carolina will enter phase one. Levine told me today he stands by that email.
When you open up and allow more people to intermingle, no matter how many precautions you take, there's going to be an uptick. And we're not doing enough tracing and testing to really catch all of that.
Phase one will allow malls to reopen and people to gather outside with friends. But that's not what Levine is worried about, since the stay-at-home order is still technically in place. His major fear is 2 weeks from now if that order is lifted, allowing places like salons and bars to reopen. He says the last thing he wants is a resurgence, when all of that social distancing we've been doing would have been for nothing.
I see the suffering that this collective quarantining or staying at home measures have created. There's no question. There is very real hurt that these are causing. My whole thing is I would hate for the amount of misery that we have paid into that misery account to be spent in vain. To have to go back and do this again if numbers spike up, I think would be the ultimate tragedy.
One of the people who received Levine's email was Mecklenburg County Health Director Gibby Harris. 3 times during a news conference today, I pressed her on whether she was comfortable with the state rolling into phase one. She did express some minimal concern.
I would not be a public health professional if I did not have concerns. However, concerns can't stop us from moving forward.
But what if there is a resurgence like Levine is warning about? Whose fault will it be if our hospitals become overwhelmed? I asked her.
Gibby, if our hospitals are overrun with patients in 6 weeks, who will be to blame?
I don't anticipate being overwhelmed in 6 weeks. We will know sooner than that whether we are seeing increases, and we'll start addressing that appropriately.
Levine hopes in 6 weeks he's wrong.
You know what? If we have weathered the storm, I hope that somebody will be able to write an article about me and say what a crank I was for coming up with all this stuff and raising this stuff to people's attention. I mean, I hope that I'm labeled that. Because that'll mean we've gotten through this. But history doesn't support that. History supports that we will see a resurgence as people interact more because we haven't eliminated the virus and we don't have a vaccine.
So tonight, Joe, is the state saying anything about his concerns that we're reopening too quickly?
We tried to ask Dr. Mandy Cohen this during the press conference this afternoon, but our producer who was on the call line wasn't called upon. So we then reached out to a spokesperson who stressed really that the state's metrics support a limited reopening at this time. Erica.
All right, Joe, thank you. So what does phase one mean for you? You'll be able to go to malls and state parks, gather with friends if the group has 10 people or less. But it's important to remember, even as we enter this phase one, we are still under a stay-at-home order, something the county health director stressed today.
This should not be seen as an opportunity to go back to business as usual. We are depending on the community not to act as if we're going back to the way things were before Christmas.